was supposed to be asked by Dr. Salik Govind, but I've allowed that the question be asked by Honorable Veena Bhatnagar to ask question 86. You have the floor.
Thank you, Mr. Speaker, sir. My question is to the Minister for Health and Medical Services. Can the Minister update Parliament on the measures taken to manage patients who need medical and surgical treatment abroad due to border closure?
I call on the Minister for Health and Medical Services, the Honorable Dr. Iferimi. You have the floor, sir.
Honourable Speaker, and I also thank the Honourable Member for that question. Honourable Speaker, the Overseas Medical Referral Scheme has been one of the victims of the border closure that many countries, including Fiji, have put in place to protect our population from COVID-19 global pandemic. And then, as I've alluded to, it's not only Fiji, but many countries around the world that refer on an overseas medical treatment scheme. And we traditionally send our patients to New Zealand, Australia, and India for high-end specialist medical services that are not available in Fiji. And these arrangements ensure that Fijians who are eligible under the scheme get the assistance from government to access these services at no cost or at a fraction of the total cost of this treatment. This is also in addition to those who are going through private providers. As we know that it's estimated that anywhere in between 15% of Fijians, working Fijians, have private insurance. So what I'm talking about specifically here is those that are going through the Fijian government scheme. Since the pandemic, we worked hard to negotiate with overseas hospitals, ministries of health, and overseas country missions in Fiji the avenues to facilitate the transport of patients to target hospital overseas that can treat our patients safely and effectively. And a lot of these countries that we've been discussing, they've actually, in the interim, they stopped us from being able to go across. And then when that became available, the opportunity to go, there were certain restrictions, including the need to actually go into quarantine. These referrals are made with due consideration of the severity of the patient's disease and the requirement for timely treatment and medical intervention to ensure maximum benefit, while balancing the risk of exposure to the COVID-19 virus to the benefits of the treatment sorted. Honourable Speaker, at this juncture, I'd like to highlight that what happens is when someone is referred for an overseas treatment, then that referral, when it's addressed to the Permanent Secretary, is then put across to a multidisciplinary team of specialists that actually go through it and discuss with their colleagues overseas to ensure that that the referral actually has a benefit. We've had in the past patients who, for example, already have cancer, who have spread to many parts of the body, who have been denied on the basis that going across overseas will not actually lengthen that time of survival. So there's a particular process that has to go through. We are grateful that the New Zealand government since 2020 has been accepting our patients of the initial hold-ups, and in spite of its strict border restriction policies in place, and in particular for our babies and children who need urgent treatment overseas. These patient transfers have been made possible through the New Zealand Medical Treatment Scheme and the Ministry of Foreign Affairs, MFAT, that funds the cost of this treatment in specialist hospitals in New Zealand. We're also grateful that we are working with the New Zealand Health Ministry, and they have approved some of our patients, due to the severity of the illness, to spend their quarantine in the hospitals in New Zealand while they are undergoing treatment, instead of the mandatory 14-day quarantine in the managed isolation facilities at the New Zealand border. And again, I just want to highlight again, what happens is you actually have to apply for a quarantine space. That's what happens. You have to apply to New Zealand for a quarantine space. They will then tell you back that the space is available, for example, next month, this particular time. Then you can then work on your itinerary. So you can see for critical patients that is not going to work. So we're very, very thankful that the Ministry of Health of New Zealand allows us to actually send these critical patients directly into the hospital system and quarantine them. From January 2020 to March 2021, we transferred 10 patients to New Zealand. And also from February 2021, after regular assessment of the global COVID-19 pandemic, with ongoing negotiations, the ministry has started to transfer patients to India. We managed to send 2 across, and we have another 11 patients that we are now organizing to send across to India. The ministry is also currently organizing for the transfer of another 2 patients to India, and the total cost of overseas transfers to both India and New Zealand is about $110,000. The majority of these patients that are sent overseas are for specialist treatment for congenital heart disease, cancers, and coronary heart disease. And it is the intention of the ministry to ensure that all overseas transfers organized by the ministry are safe and efficient given the many challenges brought on by the global pandemic. For patients who for various reasons cannot be transferred during this time, they are continually followed up and treated in our hospital by our local specialists and would be considered for overseas transfers once there is a favorable assessment of the global pandemic situation and their physical condition allows for the long-term travel. Thank you, Honourable Speaker.
Thank you, Honourable Minister. We'll move on to the 7th oral question for today.